Hello everyone, I am Dr. Sankeert Gangakhedkar, eye specialist and retinal surgeon at Keshav Nethralaya Eye Hospital, Hyderabad. And today we will be discussing about few common myths and facts about diabetes and its effects on eye. As you all know, diabetes is a disease affecting body's ability to control blood sugar levels via insulin. Now let's discuss about common myths and its facts about diabetes and diabetic retinopathy. The first myth of the day is diabetes does not affect the eye. Diabetes is a disease in which the small blood vessels of the eye are affected, and in turn it leads to various occlusion of the vessels and leakage of the vessels. The common eye diseases due to diabetes are diabetic retinopathy, diabetic macular edema, cataract, and glaucoma. The next myth is diabetes under control does not need an eye checkup. In spite of blood sugar levels being normal, there is high risk of occurrence of diabetic retinopathy. More the number of years the patient is having diabetes, the higher is the risk of occurrence of diabetic retinopathy. The next myth is diabetic retinopathy doesn't occur in young individuals. Diabetic retinopathy can occur in all age groups, and as discussed, the increase in the duration of diabetes can increase the risk of diabetic retinopathy, and the risk is increased in association of other comorbid conditions like hypertension, anemia, and hyperlipidemia. The next myth is diabetes is only a disease in urban and developed countries. As you all know, slowly India is becoming the diabetes capital of the world, and the presence of sedentary lifestyle, changing in food habits towards junk food, and decreased physical activity, all these factors lead to increased occurrence of diabetes in people as young as 25 years. In contrary to a popular belief that only occurrence of diabetes and diabetic associated complications in urban population, we are now seeing an increasing trend of rural population also getting affected with advanced diabetic retinopathy. The next myth is normal vision means our eye is free from diabetic retinopathy. In contrary to the common belief that normal vision excludes any underlying diabetic retinopathy, the vision in diabetic retinopathy is usually affected in the later stages when the center of the retina is affected, that is our macula. Whereas diabetic retinopathy usually begins by affecting the periphery of the retina, and slowly it comes towards the center, and vision is commonly affected in the later stages of diabetic retinopathy. So, it is always important that irrespective of your vision, you should regularly get a complete eye and retinal examination as early as once a year since diagnosed with diabetes. The next myth is treatment of diabetic retinopathy can be stopped once blood sugars are under control. Treatment of diabetic retinopathy is different from treatment of diabetes. However, once the blood sugar levels are under control, we can prevent further progression of diabetes, but the blood vessels, once damaged, require close follow-up, frequent monitoring, and treatment if necessary. The next myth is there is no treatment for diabetic retinopathy. Diabetic retinopathy passes through various stages, which are mild, moderate, and severe non-proliferative diabetic retinopathy and a proliferative diabetic retinopathy. In a mild and moderate stages of non-proliferative diabetic retinopathy, the usual forms of treatments include close follow-up and complete eye examination once a year. Severe and proliferative forms of diabetic retinopathy, we would require pan-retinal photocoagulation laser, sometimes anti-VEGF injections. Diabetic macular edema, it is a condition in which there is swelling of the center part of the retina, which is called macula. This is another visually threatening complication of diabetes. So how do you diagnose diabetic macular edema? Diabetic macular edema is diagnosed with the help of optical coherence tomography, which detects swelling of the central retina, which is macula, and fluorescein angiography, which detects leakage of blood vessels of the retina or microaneurysms and hard exudates. The usual treatment forms of diabetic macular edema includes anti-VEGF injections, intravitreal steroids, and focal laser. Last myth is advanced diabetic retinopathy leads to permanent blindness. Advanced diabetic retinopathy includes occurrence of vitreous hemorrhage, which is bleeding inside the eye, and tractional retinal detachment, which occurs due to shrinkage of the retina. When these advanced diabetic retinopathy occurs, the usual form of treatment is surgery, which is called vitrectomy, which involves removing the blood inside the eye and attachment of the retina. Diabetic retinopathy is a sight-threatening complication of diabetes mellitus. All diabetics, in addition to good control of blood sugar and lifestyle modification, would require complete dilated eye examination to rule out diabetic retinopathy. A stitch in time saves time. Prompt diagnosis and treatment of diabetic retinopathy would prevent permanent blindness due to diabetic retinopathy. Thank you.